Okay, guys, welcome back. So we are going to review Module 4 in phlebotomy, our venipuncture basics and supplies. Let's go ahead and look at our Google Classroom real quick and see what's in this module. There may be a couple little alterations because I have some additional updates to make to this section, but we're going to have our lecture video. We're going to have our 30-second video on the proper way to alcohol your venipuncture site, just to highlight that a little closer. We're also going to have a demo video on the full explanation of venipunctures, steps all the way through it. We have your slides. We have 2 sets of slides and a document that we are going to review in this lecture video. We have our study guide, and then we have our Quizlet flashcards. This document will actually end up merging into your study guide. So just side note, it may not be here when you come in to do this Google Classroom. And then you have your quiz, Module 4, Venipuncture Basics and Supplies. All right, so Module 4 is our venipuncture basics, supplies, and needles. By the way, we have a separate set of slides for that. So venipunctures are both an art and a science. Okay, the science is in the technique, and it's an important challenge that you're going to learn in our class. As a new or experienced phlebotomist, your hardest challenge is the art of how to perform the venipuncture technique with compassion. Okay, the actual steps are easy to remember, but actually performing it is the art. So we will cover the basic principles and techniques to perform a venipuncture in your employer or institution to provide you, your employer institution to provide you with specific protocols. So your employer will give you any changes to this protocol or alterations. You'll hear me throughout our classes and our modules saying, well, that's up to the employer, but I would recommend this. So your employer may change those steps and processes. Okay. Procedure sites. Nearly all tests performed by a phlebotomist will be done in a venous blood situation, so in a normal vein, not in an artery, okay? Veins and arteries are often rooted right beside each other in the tissue. So if it has a pulse, it's an artery, don't use it. I will not be training you guys how to perform tests on arteries, okay? So some of the things that you may run into is hitting an artery that can cause extensive damage or bleeding. Most probable site for a venipuncture will be on the inside of the forearm in the antecubital fossa, which I will show you in the next screen. And if you need to find another site, the arm is divided into different sections, and we'll also cover alternatives, which we can't do without a physician's order. So we have our dorsal, which is the back of the hand and lower arm. The flexor, which is the flat surface of the forearm. The volar, which is the palm of the hand. And the wrist, which is the area just above the thumb. Okay. So with these sites, let's kind of look at a little image of arms just so we kind of have a clear understanding. So the dorsal refers to the area of the back of the hand and lower arm. So that's here in the backside flat area of the arm, right? The flexor is the flat surface of the forearm. So here. The palm of the hand is the volar, so that's here. And the wrist is the area just above the thumb, that's here, okay? So when you're doing your blood draws, you will most often use the antecubital fossa. So I'm going to mark that in green here, okay? That's here. All right. Sometimes you'll draw blood in the back of the arm, in the back of the hand, which is okay. Never drawing blood in the underside of the wrist here. Okay. Never. ever, 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 ever. Now, some other areas that you might end up drawing blood in are the backside or the dorsal area of the arm, or even in the flexor area, and that's okay. Just never draw here. Okay. All right. So we'll move on from that. So this is a map of the antecubital fossa. We had talked about that in the last slide. So your antecubital fossa is here. All right. This is the most frequently used area. You have your median cubital vein, which is the most frequently used vein. That's this one. Okay. You never draw in the actual branch area here where they kind of Y off or connect. You want to go above it, which is here, or even in this one, which is over here. Okay. You have your cephalic vein, which is the easiest to find in obese patients. That's on the outer side of the arm over here. And then you have your basilic, which is often used as well, which is over here. Okay. If it pulses, do not use it. So if it has a pulse, that is an artery, don't use it. Your basic supplies when you're performing a venipuncture will be covered in a second, but you have two different systems. You can use an evacuated system, which has a vacuum, and a non-evacuated system, which doesn't have a vacuum. But your supplies that you'll pretty much always use are your proper PPE, needles, needle holder, tourniquet, cleaning supplies, gauze, tape, and blood tubes. So in an evacuated system, which you see in this demonstration here, this tube that they're using, the tubes have a vacuum in it. So there's a lack of air, provides a vacuum. When proper technique is used, it'll automatically draw the blood from the vein. There is a couple videos you can watch. I have one linked in down here, but I also have a demo in your Google Slides. The tube will actually stop filling when it's full, when all of the vacuum is used up, because it's automatically set to how much you need. Here's that video I had mentioned. Come back and watch it if you'd like. This is not a video of mine. This is one off of YouTube, but I do have some linked in of my own. A non-evacuated system is a syringe system where you manually have to apply the pressure to the plunger on this syringe to pull or draw that blood from the vein. Okay. We may or may not cover it in class. It really depends on time and how we're doing on the day of, but we can definitely do that. Okay. The CLSI, or Clinical Laboratory Standards Institute, doesn't always recommend or does not recommend using syringe draws because it's a little harder, honestly, because you're pulling back, you're trying to keep your hands steady, and it can be a little more difficult. So they actually don't recommend using it, but at times you may end up. In 12 years, I never had to use it. There's also a video on a syringe draw, so you can see how it's done. Generally, most healthy adults would not present a special need for a syringe draw. Okay. Patients that generally require special considerations for a syringe draw are both pediatric and geriatric patients, but honestly, a butterfly needle is perfectly fine for this process. You don't have to use a syringe. Now, a winged tipped needle or a butterfly is designed to help with smaller veins, or those pediatric and geriatric ones, for more complicated situations or blood draws. This can be used with a syringe or an evacuated system. The butterfly needles do come in a variety of gauges. Most commonly is a 23 gauge needle. So most common for a butterfly is a 23 gauge needle. So we're going to go into a little more detail about needles now, because you're probably like, I don't even know what the hell a gauge is. That's okay. That's okay. We're going to go through and actually look at these supplies and needles a little closer. Okay. So this is your normal vacutainer hub and holder. This is your typical setup. So I have broken it down in this picture so you can actually see the different sets or pieces to your supply. So here, this is your straight needle. The only thing missing from this is a safety device, which I actually go over later on in these slides that I'm working on. The second one is your tube holder. This is your evacuated tube. This is where the vacuum is. This tube has a vacuum in it. When you're doing your draw, this is what it all looks like put together. So the tube is actually on the needle, which is pulling blood through the end of this needle here. Now I'm going to show you that a little more detail because you're like, oh my God, where did all this come from, right? So this needle here, you have a patient needle on this side, and you have a rubber tipped needle, which is designed to puncture the top of this tube. Okay. This device, straight needle, screws into the top of this hub. Okay. And then it looks like this guy over here. Okay. So it's screwed into the hub. This is your rubber tip needle. This is your patient needle. And you have a safety device over here, which is clicked into place when you're done. All right. When this tube is pushed into the bottom side of this little holder in here, it punctures, and that's when the vacuum withdraws the blood. Okay. We'll look at that a little closer in a little bit. But you have 3 different types of needles. I just showed you a straight needle. We have a butterfly needle, and then we have needles with syringes. This is a needle. We're going to look at the needle a little closer now. So this is a bevel, okay? The bevel is there to create the sharp opening for the puncturing of the skin. In the middle of the bevel, you see this opening here, okay? That is your lumen. The lumen is the opening through the center of your needle. It's like the straw opening when you get a straw for a drink. That's where the blood actually will travel through, or if you're giving an injection, which you guys won't in phlebotomy, but if you get one, the medication travels through the lumen, okay? In a vein, the lumen is where the blood travels through in the body. So you have a bevel, okay? And you have the lumen. Now, this is the larger view. So you still have your bevel and you have your lumen here at the end, okay? This is the shaft of the needle. And then you have the hub or the hilt of the needle here, okay? And then this is your needle cap. This is a non-safety needle that we're looking at. It doesn't have the safety device attached, but it was the best picture I could find to give you guys a clear image of what that needle would look like up close with the bevel. All right, so here are gauges. Gauges is how big in diameter your needle is, okay? So this corner image down here in the bottom right is the best one to show you the differences. So 18 gauge is a very large diameter needle. You see how big it is in comparison to a 25, okay? Most often in blood draws, you are going to be using anywhere from a 21 to a 23 gauge needle. No bigger, no smaller, okay? The larger the number, so a 23 gauge needle is a smaller needle. So bigger number, smaller needle. Smaller number, bigger needle. So it's the complete opposite. Bigger needle, smaller number, smaller needle, bigger number. Okay, got it? Probably not. Take some practice. It's okay. All right, so Vacutainer needles are straight needles. We just kind of reviewed them back there, but I want to give you another view. This is what it looks like when you first take it out of the packaging. It's got both caps still on, and you have your safety here, okay? When you take your caps off, all right, the green one has the patient side. The clear one has that rubber tip needle, okay? This is what they look like. This one is the one that punctures the tube. This is the one that punctures your patient, okay? The colored side is usually the side that has your patient needle. It doesn't have to be green. It can be green, black, blue, whatever other color. Usually the color side is the patient side, okay? This safety should also be built in. So this safety is designed to be pushed with your thumb when you're done with your blood draw. It clips over top of the needle, and it is not removable after you do that, okay? So this is your full device put together. The straight needle is screwed in the hub. The tube goes in the end of the hub here. All right. Safety device activation, you just push the flat pad as seen in this image with your thumb. This is what it looks like. You want to press the thumb pad, not the tip, because it can wiggle and you can end up poking yourself. So make sure that you press the thumb pad that is designed to push it over. Sometimes it takes a little pressure, but it will flip into space. It will click into the spot it's supposed to go into. If it breaks off or doesn't click, just throw it straight in the sharps container. This is your wing-tipped butterfly needle. So you see these wings here? This is why it's called a butterfly needle. Okay, it's got wings. So we're going to start at this end. So you have a bevel, you have your needle shaft, you have the actual butterfly device itself with your wings, which is where you hold it. The tubing that leads down to your rubber tip needle, which screws into your hub, just like the straight needle as shown before. This is a little video describing each of the supplies to you and how they work and how they screw in. So please come back and watch that. This is a syringe needle with the draw or with the syringe on it. So you have the needle separately that screws onto the actual syringe. Okay. So bevel, needle shaft, needle hilt or hub that pops onto your plunger or your syringe. This is the barrel of the syringe, and then this is the plunger that actually gets pulled back during the draw process to fill this barrel with blood. So some things to avoid when you're handling needles: never recap your needles. If you have a safety device, use it. If that needle touches something when you lay it or you lay it down uncapped, don't use it. It's not clean anymore. If you question if it's been opened before, don't use it. If you tap somebody with the needle before you actually started or meant to do the puncture, don't use it. Get a new one. Your needle should never bend when you're poking somebody during your procedure. Okay. Activate your safety and discard the needle immediately. Don't keep it in your hand uncapped. Don't lay it down uncapped. That's all, safety precautions. A layout of your introduction for blood draws, lower extremity draws, and latex allergies. Okay. Your introduction: upon entering the room of the patient, after pulling the patient from the lobby, whatever you're doing, you're going to introduce yourself. You're going to verify your patient. You never want to assume. The first and last name and date of birth of your patient should match your requisition, their bracelet, and your pre-labeled tubes if they have a bracelet, if they're inpatient. Explain what you're there for. Get consent from the patient for the procedure of venipuncture. You may also ask them what their arm preference is, which gives you their preference, and it actually will give you their consent as well. Ask them about an allergy to latex. If you are using latex products, always ask the patient. You can explain your steps briefly as you go through the process with them as well. You may also want to make small talk to engage the patient and also to see how they're feeling throughout your process. Make sure you make eye contact and keep an eye on your patient throughout the process to make sure they're not having a syncopal episode or passing out. Okay, so lower extremity draws. Lower extremities are hands and legs or feet. Okay. Some patients may not have accessible veins. I don't know why I said hands in your lower extremities, because it's not. That's your upper extremity hand. Lower extremity is like your feet and legs. So patients may not have accessible veins in the antecubital fossa, arms, or hands. Some cases that you may see this in are IV drug users, chemo patients. Their veins will just be used up from all of the poking that they've incurred. If you're unable to locate a vein, it may be necessary to look in other areas, including the lower extremities, for access. If you have a written permission order, written permission from an attending physician or practitioner, MD, DO, nurse prac, or PA to perform a lower extremity venipuncture, you can. Okay. But you must have written permission. Do not take them on their word for it. Just because they say yes, do it, get it in writing. All right. So latex allergies. Latex allergies do produce varied symptoms, which commonly include runny nose, sneezing, itching, eyes, scratchy throat, hives, difficulty breathing, or a burning sensation where they came into contact with it. Most facilities have changed to non-latex products, but sometimes you may run into them. So if you are using a latex product and someone has a latex allergy, use something else. Find a different type of equipment that doesn't have latex, or use a barrier. Meaning, if your tourniquet is latex, find something to wrap their arm in and then put the tourniquet around that object so it doesn't come in contact with their skin. There's some more information about latex allergies listed here. All right, so for Module 4, we do have some key terms. We have 2 pages here. There are some flashcards in your mods. Please go back and look at that.